The vacated auto factory lots and boarded-up homes were familiar sights in Flint, Michigan, well before the latest recession hit. But now, there's another story unfolding here. With city unemployment at a staggering 27%, more Flint residents are unable to pay for health care, and doctors are beginning to turn away the neediest patients.
Well, more Medicaid patients were calling, and my office manager would ask, and, I just told them no.
Medicaid, the public health insurance program for the poor and disabled, and the nation's single largest insurer, has suffered severe cuts as Michigan and other cash-strapped states have sought to climb out of the red.
54, perfect.
Congress bars states from reducing Medicaid eligibility, but many states have cut reimbursements and optional benefits like eye and dental care.
Look in your ears.
Medicaid now pays doctors and hospitals so little that people insured through Medicaid are struggling to find care.
Were you thinking you were going to see Dr. Jindal? Yeah. It's just very difficult. We kind of feel like second-class citizens. You have to jump through hoops. You have to basically be living on the street just to get Medicaid. And then once you do get it, nobody will accept you.
When I first got on Medicaid, there were more doctors taking Medicaid. They were more helpful. They were more inept to help you. A lot of doctors that you try to go to now, they really just don't want to be bothered with it.
It feels a little bit scary.
It should have improved by now.
In Michigan, private insurance reimburses roughly $70 for a routine office visit like this. Medicaid pays less than half that, $30.
And taking deep breaths in and out.
When the state cut Medicaid payments 8% last year, Dr. Saeed Sahuri decided he'd had enough.
Our costs keep going up, reimbursement keeps going down, and it just made it more clear to me that I simply could not afford to continue to take care of Medicaid patients. We're really losing money on seeing those patients, not even breaking even. We were starting to lose more and more money, month after month.
When he stopped accepting Medicaid, Dr. Sahuri had to turn away nearly 100 patients. One of those was Carol Vliet, a cancer patient who lives on a farm north of Flint.
It's scary. Right now, I'm just taking it one day at a time because of the cancers.
She still sees her oncologist for the tumors that have metastasized to her brain, liver, and throat, but she worries about the quality of care she receives for her general health.
It takes a lot out of you when you got cancers in you. And Dr. Sahuri, he's a good doctor. My husband sees him. My mother-in-law sees him. You want to establish yourself and be with a doctor. You don't want to go from doctor to doctor to doctor and have strangers looking at you and that don't have a clue who you are. And then all of a sudden you feel booted.
As reimbursements have gone down, the number of Medicaid patients showing up at emergency rooms and community clinics has climbed sharply.
I have Tuesday, March 30th at 10 o'clock.
Randy Smith lost his landscaping job a year ago and quickly got on Medicaid. When he began to feel pain in his mouth, he tried to set up a dental appointment, not realizing that Michigan cut Medicaid's dental benefit in 2009.
I asked probably about maybe 5 or 6 places in my area if they would take Medicaid, but they said no.
On a friend's referral, he came to this federally supported health and dental clinic on the outskirts of Flint. During his visit, Smith learned that he needed $2,000 worth of dental work.
He needs root canal, crown, and none of those things are covered under Medicaid. Right now, Medicaid only covers for removing teeth.
I'm not sure what I'm going to do. I don't have the money.
The shrinking options for Medicaid patients could get smaller if hard-hit areas like Flint can't retain its doctors. There's increasing worry that the pressure for doctors to shoulder the cost of Medicaid could drive the most skilled practitioners away.
Looking for any signs of bleeding or tumor in the brain.
Dr. Vinu Vadlamudi is a radiologist in residence at Hurley Medical Center in downtown Flint.
Michigan trains a lot of doctors, it trains a lot of medical students, but it's a net exporter of physicians. It doesn't retain them. You're already doing essentially nearly charity care when you see a Medicaid patient. There would be really very little reason for a physician to want to stay in a state that continues to have the worst economy with worsening Medicaid and Medicare reimbursement on those patients.
For now, Ms. Vliet remains hopeful that Dr. Sahuri will be able to make a charitable exception for her.
Well, I hoped that he'd make an exception, but I don't know. And I don't know how it's going to affect my family.
I thought it was really unfair why reimbursement has to be that low. It's just very unreasonable to put all the burden on us physicians. You know, we have to survive as well.